Domestic violence has become an issue of focus for the Department of Defense, as awareness and media coverage of incidents has increased, and the specific risk factors for military-related domestic violence have been uncovered. Domestic violence, also known as intimate partner violence and dating violence, is a complicated problem, and how it's handled can be a complex process, and one that victims may not understand. This webinar is intended to provide information that can be used by anyone to help protect themselves and other community members from the effects of interpersonal violence. My name is Nicole Schwartz, and I work as a contractor in the Family Services section of the Family and Morale, Wellness, and Recreation, DLA Installation Support, at the Defense Distribution Center Susquehanna in New Cumberland, Pennsylvania. Providing support and assistance to the Family Advocacy Program, or FAP, is the focus of my work with DLA. Family Advocacy is a DoD-sanctioned program designed to prevent, identify, report, and provide treatment to families that have experienced domestic violence or child abuse. Monthly workshops and webinars are part of our regular programming. We define domestic violence as a pattern of abusive behavior in any relationship that's used by one partner to gain or maintain power and control over another intimate partner. Domestic violence can be physical, sexual, emotional, economic, or psychological actions or threats of actions that influence another person. This includes any behaviors that intimidate, manipulate, humiliate, isolate, frighten, terrorize, or coerce, threaten, blame, hurt, injure, or wound someone. Physical violence includes hitting, slapping, shoving, grabbing, pinching, biting, hair pulling. This type of abuse also includes denying a partner medical care or forcing alcohol and/or drug use upon him or her. Sexual abuse includes coercion or attempting to coerce any sexual contact or behavior without consent. Sexual abuse includes, but is not limited to, marital rape, attacks on sexual parts of the body, forcing sex after physical violence has occurred, or treating one in a sexually demeaning manner. Emotional abuse, undermining an individual's sense of self-worth or self-esteem, is abusive. This may include, but is not limited to, constant criticism, diminishing one's ability, name-calling, or damaging one's relationship with his or her children. Economic abuse is defined as making or attempting to make an individual financially dependent by maintaining total control over financial resources, withholding one's access to money, or forbidding one's attendance at school or employment. And finally, psychological abuse. Elements of psychological abuse include, but are not limited to, causing fear by intimidation, threatening physical harm to self, partner, children, or the partner's family or friends, destruction or abuse of pets and property, and forcing isolation from family, friends, or school or work. Research has revealed that there are specific risk factors for the military community. The intention of mentioning this is not to criticize members of the uniformed services, but to assist in cultivating an understanding of the unique needs of our service members and their families. Military families are at a significantly higher risk than civilian families for domestic violence. Studies by the Department of Defense indicate that domestic violence in the U.S. military is 2 to 5 times higher than that in the civilian population. There have been numerous cases of domestic violence and child abuse in military communities across the U.S. and the world, which have led to death. What are the unique contributing factors? Our country has been at war for the last 16 years. Like conflicts of the past, these deployments, the type of warfare, and the demands on the service members and their families have changed. The demands on forces, especially those within the National Guard and the reserve units, is especially high after a significant uptick in the deployment cycles and continued stressors. High levels of stress created by the cycle of deployments and reintegration, recovery from physical or psychological injuries, or military transitions can add to the risk of abuse. Frequent relocations that separate military families from friends and other social support systems can add to high stress levels. Economic dependence of many military spouses can prevent someone from reporting abuse. And studies indicate that traumatic brain injury or head trauma and the diagnosis of post-traumatic stress disorder are significant risk factors for domestic violence. Domestic violence can happen to anyone, regardless of race, age, sexual orientation, religion, or gender. It affects people of all socioeconomic backgrounds and educational levels, and occurs in both opposite sex and same-sex relationships. It can happen to intimate partners who are married, living together, dating, or have had a child together. Domestic violence not only affects those who have been abused, but it also has a substantial effect on family members, co-workers, friends, other witnesses, and the community at large. Children who grow up witnessing domestic violence are among those seriously affected by the crime. Frequent exposure to violence in the home not only predisposes children to numerous social and physical problems, but it also teaches them that violence is a normal way of life, therefore increasing the risk of becoming society's next generation of victims or abusers. Studies show that between 3 and 4 million children between the ages of 3 and 17 are at risk of exposure to domestic violence each year. U.S. government statistics say that 95% of domestic violence cases involve women victims of male partners. The children of these women often witness domestic violence. Witnessing can mean seeing the actual incidents of physical and/or sexual abuse, hearing threats of fights, noise from the other room, observing the aftermath of physical abuse such as blood, bruises, tears, or torn clothing, or even broken household items. And finally, children may be aware of the tension in the home, such as when their mother's fearfulness when an abuser's car pulls up. Not all children exposed to violence are affected equally or in the same ways. For many children, exposure to domestic violence may be traumatic, and their reactions are similar to children's reactions to other traumatic stressors. According to the National Child Traumatic Stress Network, children's immediate reaction to domestic violence may include generalized anxiety, sleeplessness, nightmares, difficulty concentrating, high activity levels, increased aggression, increased anxiety about being separated from a parent, and intense worry about their safety or the safety of a parent. And long-term effects, especially from chronic exposure to domestic violence, may include physical health problems, behavioral problems in adolescence, which may include juvenile delinquency, alcohol and/or substance abuse, and emotional difficulties in adulthood, such as depression, anxiety disorders, and PTSD. Exposure to violence has both short and long-term effects on the individual's well-being. It's not always easy to determine in the early stages of a relationship if one person will become abusive. Domestic violence intensifies over time. Abusers may often seem wonderful and perfect initially, but gradually become more aggressive and controlling as the relationship continues. Abuse may begin with behaviors that may easily be dismissed or downplayed, such as name-calling, threats, possessiveness, or distrust. Abusers may apologize for their actions or try to convince the person that they're abusing that these things are out of love or care. However, violence and control always intensifies over time with an abuser, despite the apologies. What may start out as something that may at first be believed as being harmless, such as wanting the victim to spend all their time with the abuser because they love them, can escalate into extreme control and abuse, like threatening to kill or hurt the victim if they speak to family or friends. Some examples of abusive tendencies are included but are not limited to the examples that are listed on this slide. It's important to note that domestic violence does not always manifest as physical abuse. Emotional and psychological abuse can often be just as extreme as physical violence. Lack of physical violence does not mean that the abuser is any less dangerous to the victim, nor does it mean that the victim is any less trapped by the abuse. After having discussed what domestic violence is and what the signs of a violent relationship are, I'd like to talk about what we can do to offer assistance to someone that we suspect is being abused in their relationship. Here are ways that you can help, assist, or support somebody that you believe to be in a violent relationship. Show your concern. Let the person you're concerned about know that you're ready to listen and to help, and encourage the victim to seek medical attention for any injuries that they may have. Offer information on support sources. You can urge the family or friend or community member to contact the installation's Family Advocacy Program, or to speak to a victim advocate, or to call a military crisis line at 1-800-273-8155 and press 1. Make sure the victim understands the military's options for reporting domestic abuse. Except in certain circumstances, victims can get assistance from the Family Advocacy Program victim advocate and receive medical care without it automatically resulting in an abuse investigation or notification to a service member's command. Call 911 if the victim is in immediate danger of assault or physical injury. If you're on a military installation, call the DLA, police, or military law enforcement. Remind the victim of the impact of domestic violence on children. We talked about it in the slide. Whether or not they're physically experiencing violence, children living in a violent household suffer from emotional and psychological damage, both short and long-term effects. Remind the person that abusers rarely stop without help, regardless of what they promise. An incident of domestic abuse is often followed by a honeymoon period. When tensions mount, the violent behaviors returns. Another thing that you can do to offer assistance is to be there for the person. A victim of domestic abuse may need you to make phone calls, to go with him or her to the police, or to help with childcare while they're working out a safety plan. Although you can't do it all, you ask to see what it is that you're capable of doing to provide assistance and what ways that you can help. Respect the decisions. You may wonder why the victim stays in an abusive relationship. Many, many, many reasons exist, and none of them are very simple. But offering your respect for the victim allows for them to make choices that they believe are best for themselves and their family. And finally, respect and support a victim who chooses to stay. The victim often returns to an abuser several times before leaving for good. Your continued help, support, and encouragement are vital to their health and wellness. Deciding whether to report domestic abuse is very difficult. Victims of domestic abuse can feel confused, alone, or afraid to get help. If a partner is abusive, knowing the reporting options may help a person to decide what's best for them and their family. The Department of Defense is committed to addressing and ending domestic abuse. Except in select circumstances, victims have the option of making either a restricted or an unrestricted report of domestic violence. Both options allow for access to personal help and support, also known as victim advocacy services. Victim advocates can assist with helping to plan safety plans, provide information and referral services. They can provide information about military and also civilian protective orders, and accompaniment to meetings and medical and court appointments. Restricted reporting. Knowledge is power, and confidential information and support can help victims decide how to proceed. The Family Advocacy Program Manager, or Victim Advocate, or a military healthcare provider can be contacted in order to request a restricted report. Making a restricted report means that no law enforcement is notified, that there's no command involvement, and victims can receive access to medical care, counseling, and support, and also victim advocacy services. They also can utilize this as time to evaluate their relationship choices, and victims themselves have control over what and how much information is shared with others by making a restricted report. Because victim safety is a priority, if someone presenting for assistance is in immediate risk of serious harm, they cannot use the restricted reporting option, as those providers have a duty to warn. The restricted reporting option does not apply to child abuse cases. Unrestricted reporting. If and when a person becomes ready to make an unrestricted report to law enforcement, he or she may contact the Family Advocacy Program, military police, or chain of command. Making an unrestricted report provides the victim with law enforcement investigation of the abuse incident, command notification and potential administrative action against the offender, support and protection from the command, victim advocacy services, information on legal rights, and assistance in applying for transitional compensation if that's applicable. In an abusive relationship, deciding what to do is not at all easy, but knowing the options is the first step toward ending abuse and creating a safer, happier life. Many people believe that the solution to the problem is for victims of domestic violence to leave their relationship. This belief is often stated, heard, and repeated in movies and television shows, and during misinformed newspaper articles and news coverage of violent-related incidents. But domestic violence does not always end when the victim escapes the abuser, tries to terminate the relationship, or seeks help. Often, quite opposite, it intensifies because the abuser feels a loss of control over the victim. Abusers frequently continue to stalk, harass, threaten, and try to control the victim after the person escapes. In fact, the victim is often in the most danger directly following the escape of a relationship, or when they seek help. 1/5 of homicide victims have a restraining order, or PFA. They are murdered within 2 days of obtaining the order. And 1/3 are murdered within the first month. So it's important. Part of advocating for the safety is understanding safety planning. During a violent incident, a safety plan when an individual is planning to leave, and also after an individual leaves the relationship. This is one way that you can help a victim of domestic violence, or someone that you believe is in a violent relationship, providing this information to them. During a violent incident, avoid rooms with no exits like bathrooms or closets. These are typically rooms that individuals feel safe and hide in. And avoid rooms with weapons like the kitchen. Get to a room with a door or a window so that an escape route is possible. If possible, lock the abuser outside and call 911. Get medical attention if necessary. If there's contact with the police, get the name and badge number of the officer. And contact a domestic violence program, the National Domestic Violence Hotline, or go to a safe house or shelter. There are some things that can help individuals who are planning to leave. When leaving an abusive relationship, it's important to take with you the documents necessary to get the resources and help. The following items may be needed: a driver's license, passport, the birth certificate to verify identity, Social Security cards for both the victim of abuse as well as any children, leases and deeds that have a name attached to them, credit and debit cards, pay stubs, W-2, insurance policies, bank statements, and checkbooks. Also, any documentation about the abuse, including pictures, recordings, medical records, and police reports. These are things to have tucked away in a safe bag that you can stash at a friend's house or at work. Safety when leaving. Change a phone number. Safety after leaving. Change a phone number or other contact information and screen calls. Consider getting a restraining or protective order. Speaking to an advocate at the local Victim Assistance Center can provide information on all the options that are available. Save and document all contact, messages, injuries, or other incidents. Change locks. Avoid being alone. Make an active plan on how to get away in the event that you are approached by your abuser. And if you have to meet them, choose to do so in a public place. Vary the routine in order to help assure a higher level of safety. If a restraining or protective order has been issued, a copy should always be kept on you. A copy can be left at work and provided to the children's school and every place that the children might spend time, like a child care center or grandparents' house or friends. We also encourage victims of domestic violence to join support groups at local domestic violence programs. This is a list of resources that may be important to your safety or to the safety of someone that you know or care about. The DLA Police Dispatch Number, 717-770-6270. On the Defense Logistics Agency, Defense Distribution Center, Susquehanna, the police dispatch are the reporting point of contact for incidents of domestic violence. The Family Advocacy Program can be reached at 717-770-7066. And the Family Advocacy Program Manager and any staff can assist with victim advocacy. The National Domestic Violence Hotline at 1-800-799-SAFE can provide information, resources, and referrals. Military OneSource at 1-800-342-9647 provides information and resources and confidential one-to-one phone assistance. And Contact Helpline is a comprehensive health and human service information and referral service helpline for all of South Central Pennsylvania. The organization maintains a database of information regarding services that are offered by nonprofits, governmental programs, support groups, and clubs. The service is free, anonymous, and it's available 24 hours a day, 7 days a week. And all an individual has to do is dial 211. Thank you for viewing the Family Advocacy Program's webinar. We appreciate your time and attention. If you have any additional questions regarding FAP, seek referral for programs or services, or would like to know more about our mission, please feel free to reach out to the Family Advocacy Program Manager at 717-770-7066.